Hi, welcome to the newest edition of SCF On Campus. I'm Daisy Volovich, and for today's newest edition, we're going to be looking at some of the things that are going on here at SCF Lakewood Ranch, the campus that is fast growing and fast moving with new programs and services. Today's program, we're going to look at two ways that SCF works with the local community in really helping drive the economic engine of workforce development. In one segment, we're going to look at some of the programs and services offered by Workforce Solutions and how we, along with many of our community partners, help employers grow and expand their business. The other part of today's show is going to be taking a tour of our newest and proudest efforts at SCF, and that's our Medical Technology and Simulation Center, and looking at some of the offerings that we have in healthcare. So I'm so glad you're here to join us, and stay tuned, we'll be right back. State College of Florida is dedicated to working with local employers and meeting their workforce needs. To that end, we have a department at the college called Workforce Solutions. Joining us today is David Auxier, the Director of Workforce Solutions, who's going to tell us a little bit about the kinds of programs and services he offers. Welcome, David.
Hey, Daisy. How are you doing?
I'm doing great. So tell us a little bit about what is Workforce Solutions.
Well, Daisy, our mission is really to assist companies in remaining competitive. We offer training and consultative services that help companies improve their performance. That's really the bottom line.
So making what we've got bigger and better in terms of our human capital.
Absolutely.
Okay.
Absolutely.
And so how do you do that?
Well, we assist companies through developing an assessment tool. We meet with supervisors, other folks in leadership roles within the organization. We determine what the needs are, and then we come up with a plan to assist them in improving, in making the correct investments in human capital.
Can you give us some examples, like maybe over the last year or so, of some of the programs that you've developed for companies?
Absolutely, absolutely. We have worked on a Lean Six Sigma program with a number of companies. One of them is Medi, which I think you're going to be looking at later, some of the simulators that we use in our simulation center. Mm-hmm. We assisted them in streamlining their performance management system. We also have helped the city of Northport with a whole comprehensive revision of their supervisory training program. Any number of programs. One of the most meaningful programs that we've done of late is to design a program to help implement a company utilizing a program, a Microsoft software program called SharePoint, which really allows them to share documents in a much more effective way. When you're writing a proposal, you may need to collaborate with several entities, and you may need to do that in real time. Sometimes deadlines are very short. So we've been able to train folks to use that program, and it's very, very powerful.
That sounds like a program that a lot of companies could really use. What are you doing to let companies know about some of the programs and services that you offer?
Well, we're active with all of the chambers, the economic development organizations. We work very closely with Suncoast Workforce and their business services team to get the word out about these types of offerings.
Okay, so it sounds like SharePoint and computer applications are some of the kinds of classes that you offer. Do I need to bring my employers to the college in order for you to do that?
Absolutely not. In about 50% of the cases, we actually send instructors, equipment, really everything that they need right to their doorstep.
So I want computer training, you'll actually bring computers out?
Absolutely. We have a state-of-the-art mobile laboratory. If that's not available, we work with Suncoast Workforce. They have a mobile unit which they can take on site. So whether it's computer training or live stand-up training, we can do that at their site without a problem.
What about some of the other kinds of training in terms of investing in human performance, some of the soft skills that you do? Give us an example of those.
Well, recently we worked with Miami-Dade Community College to bring a program that's been very successful, has over a decade of success down there. It's called the Institute for Customer Service Excellence, Institute for Customer Service Excellence. That's in its first offering this past semester. We've had excellent reviews of it, and basically what it's about is stepping up our customer service, all aspects of customer service. There are about 8 classes in that program, and it's been very well received in the community.
Other kinds of leadership and management classes that you do?
Absolutely. Well, we have a number of offerings, call center management. We have a program that's specifically geared towards manufacturing, that's business management and supervision. There are any number of them, but what we do, the real strength here is that we go in and we work with the particular organization, find out what the points of pain are, and then design a program that's specific to their needs. Now there are some core competencies that are built into that may run as a thread through all different programs. For example, performance management. How do you conduct hiring? How do you conduct a behavioral interview? How do you set performance expectations? How do you coach and counsel people along those lines? Those are some cores that really go across whatever type of organization you're working with.
I know one of the things that you've been actively involved in is rather than doing a one-shot offering at a company, I know you've been working very much, for example, with Manatee County government. Tell us a little bit about the kinds of really institution-wide programs, if you will, that you develop.
Absolutely. You know, a one-shot training program can be very powerful and help to jumpstart a company, but the real strength is an ongoing relationship where every quarter, every month, we're doing some sort of performance intervention to keep it fresh. If you don't sharpen the saw, you're not going to be able to cut the wood. So we really try to help companies build a culture of learning.
Okay, great. So what do you think employers in our community need to know about you that maybe they don't? What's the message?
Well, really that there's not really an area of business improvement that we don't work in. We can help them with language training. We can help them with writing manuals for their own internal procedures. We can help them with performance improvement. We've got experts not just through the college but throughout the community, our network. We can even assist companies to bring out of the consultants and trainers from outside the state and save them money. We're a nonprofit organization, so typically trainers and consultants have a different rate for nonprofit organizations, and we can help pass along those savings to them.
Well, that's a wonderful service. So it sounds like cost savings, customizing, collaborating are just some of the things that Workforce Solutions does. And when we come back, we're going to hear from Suncoast Workforce and some of the ways that SCF collaborates with one of our many important workforce partners in our community. So stay tuned, and thank you, David, for joining us today. As we mentioned, State College of Florida collaborates with many of our local partners in delivering workforce training services. There are so many programs available for employers, and one such program comes through Suncoast Workforce. Joining us today is Jennifer Seavey from Suncoast Workforce. Welcome.
Thank you, Daisy.
So tell us first of all, what is it that you do at Suncoast Workforce?
I'm part of the business services team at Suncoast Workforce, and we assist employers in Manatee and Sarasota County with multiple services.
Well, I see in your brochure that employees are our greatest asset. Tell us a little bit about the mission of Suncoast Workforce. You've recently undergone some rebranding like we did.
Yes, we have. Our mission at Suncoast Workforce is to recruit, train, and retain talent for the Suncoast. What that means is we are able to source the career seekers in our region and recruit our job seekers to the region, and then match them to the jobs with the employers in our region so that we can retain our talent here.
Okay, so one of the things as we work with local employers, it's been really exciting to see that there's some growth happening in our area. We've got companies like Tervis Tumbler and Manatee County's recruited several new companies, Mustang Vacuum, to look at adding new jobs. So now we've got the opportunity to add new employees to the region. How does Suncoast Workforce help an employer do that?
Well, we can post and manage their job openings on Employee Florida Marketplace. By doing so, we take the burden off of the employer to manage an online job posting. Then beyond that, we pre-screen qualified applicants and only send the employer the applicants that meet the requirements of the job. So it saves the employer time and money because they don't have to sift through 1,000 resumes of potentially unqualified candidates.
So an employer, especially one that maybe isn't a very large employer, and especially when you're looking at job expansion, there's so many things going on at a company, having someone to help you with some of those HR kinds of responsibilities sounds like something Suncoast Workforce could do.
Absolutely.
And what's that cost an employer?
There's no cost for any of our services at Suncoast Workforce.
So what's it cost an employer to have these services?
That's a great question, Daisy. There is no cost to employers for any of Suncoast Workforce's services.
Wow, so being able to have somebody come in and work with me to help me recruit and assess prospective employees are just some of the services it sounds like you offer. What are some other programs that you have that assist employers in their hiring practice?
Well, we can do skill assessments, we can do on-site job fairs either at the employer's location or at any of our 3 career centers. We have mobile units that are available to come to your work site, come to employer's work site and provide either use it for training or for a job fair or for any need they have.
And I know you, like us, have lots of acronyms that describe the programs and services. Let's spend a few minutes talking about one that I think might be particularly of interest to employers who are looking for hiring new jobs, and that is OJT. What's OJT all about?
OJT is the on-the-job training program, which is an excellent program for employers who are ready to hire new employees and able to take on an employee who may need training in that occupation. We can, at Suncoast Workforce, help the employer write the job description, develop a training plan for the individual, and the best part of it is we can reimburse 50% of the employee's wages for a set training period while the employer provides training to that new employee to get them up to speed. It's one of the best programs we have.
Sounds like a very well-kept secret. How do I learn more about OJT?
You can contact the business services team. We have 2 OJT specialists on staff who can help assess the need and the position as well as write the training plan, job description, and refer the eligible candidates.
Okay. That's one of the many services that they've got for employers. And when we come back, Jennifer and David Oxy are going to tell you about one of the other training services that Suncoast Workforce provides, where State College of Florida has been a very important partner in delivering workforce training services. So stay tuned, and we'll be right back to learn about another acronym.
I'm here with Jennifer Seavey from Suncoast Workforce, and we're learning a little bit more about what they do to assist employers. Jennifer, tell me, what is EWT?
Great question. EWT is Employed Worker Training. Employed Worker Training is a program for employers where we can offset the cost of training their existing staff for skills upgrade training, customized, any training that their employees would need to help them become more innovative or stay cutting edge.
Excellent. Is there any limitation to the amount of funding that companies can receive?
Not at this point in time. We don't have a cap on the amount of funding. However, it is up to 50% of the cost of the training.
Wow, EWT sounds like a really powerful program. How do folks get in touch with you?
Well, they can find additional information on our website at www.suncoastworkforce.org, or they can call any of our career centers. The main number is 941-358-4200, and they can just ask for the business services team.
Thanks so much for your service to the community, Jennifer.
Collaboration and coordination with community members is such an important aspect of how State College of Florida conducts business. In trying to bring a baccalaureate degree to our community in nursing, we turn to our community partners to help us look at why do we need such a program. Joining us today are two of our community partners, and let's hear a little bit about why the BSN program was important to them. First, please tell us who you are.
Hi, I'm Suzanne Tersiak. I'm from South Bay Hospital in Sun City Center. It's a 120-bed acute care facility.
Did I hear you say Sun City?
Yes.
Wow, so you've come a long way to work with us, haven't you?
It takes about 30 minutes.
Okay, great. Well, we're so happy that you joined us in this endeavor. And you are?
I'm Lou Ann Angelo, and I'm from Englewood Community Hospital, which is a 100-bed community hospital, acute care facility.
So in terms of looking at our region, just looking at the wide array of community partners that we had joining us certainly speaks to how important this really must have been to you. Tell us a little bit, why was the BSN degree important for people in your area?
Well, the BSN degree, as you know, is a midpoint for nurses, and in our community hospital, most of the nurses that work there have associate's degrees, and to elevate the education of those nurses so they can meet the needs of the patients is key for us. The acuity of patients in hospitals, the equipment that they're using, the research that they need to be able to understand, it's all part of that program.
So in order to really invest in your human capital and ensure that they had the state-of-the-art training available to them, the BSN degree helps you in that endeavor.
Absolutely.
Great. And what about Englewood? Why was this so important to your community?
Well, it's important to our community because we really needed to have state-of-the-art education, level of BSN, right here in our own backyard, rather than having to go to a big city or a big school facility farther away. Because most of these nurses are working nurses, so we really needed something to work around their schedule and to be able to continue working full-time and yet still continue their education. As a nurse, they are committed, we are all committed as nurses, and Suzanne will probably agree with me, to become lifelong learners. So it's absolutely needed, and we fully supported this endeavor.
Well, we're standing here in the Medical Technology and Simulation Center, and you've both alluded to how important simulation is. But for some of us who don't know what that means, what does the Simulation Center mean to you in terms of the kind of training that you're looking for with your people?
To me, it's an opportunity for students at any level to come in and practice in a safe environment, be led by experts in that area, not risk endangering a person's life. So I think that's a fascinating thing, and what they have set up here is incredible. So I'm kind of jealous I didn't get to learn in this environment myself.
Actually, we were talking right before the cameras started to roll about how back when some of us were in school, the way we learned is practicing on each other. And we were wondering why we never have class reunions, because perhaps some of our practice didn't really result in a good thing. Luann, what do you hope that your people will gain from coming out here to do some of their training?
We're hoping for a higher level of nursing care. Our patients are, as Suzanne said, much more acute. So we're looking for a higher level of care, a more critically thinking nurse, and it's supported by the Institute of Medicine. All the nursing organizations want to look at bringing up our level of entry for nursing to a BSN level. So it's the first step, and it's a great step to have right here in our community. Yeah.
So for somebody who might currently be a nurse with an associate's degree, what advice do you have to them as far as thinking about, it's always still a big step for people to go back to school. What advice would you give them, Luann?
Just start one course. Just take one course and do it right here, because you don't have to go far, and it's very convenient. And with our simulation lab, it really builds the self-confidence of the nurse before they get out onto the floor and touch real live human beings. So that is really helpful. I would tell everyone, well, I do tell everyone, oh, you've got your associate's degree, that's great, let's go on. When do you sign up for your bachelor's degree? And you can do it right here, you can keep going. So, and it's affordable.
And so you can come right here in your own community at Lakewood Ranch and our other 2 campuses. We have Venice and Bradenton, but of course no one has the Medical Technology and Simulation Center. So on behalf of Flo and some of our other wonderfully sophisticated patients here in our ICU, thank you for joining us, and thank you both, because we could not have done this without you as employers in our local area telling us this is what you need. So thank you so much for investing your time in helping us in these efforts. Well, we're here with Dr. Bonnie Hesselberg, Provost of the State College of Florida Lakewood Ranch site, as well as Dean of the Baccalaureate in Nursing program, and really the person who helped spearhead the design and the development of the Medical Technology and Simulation Center. Dr. Hesselberg, let's start by talking a little bit about what people are seeing as they look through this facility.
Well, as you come into this facility, you will notice that it has a lot of community involvement, but you'll also notice that there's a patient in every bed. The patients are mannequins that simulate the human body, if you will, exactly what it is that the human body would be responding to if we gave that person a particular type of medication or some procedure, then our mannequins will respond accordingly. And so we have built this as an intensive care unit, but we've also built it, if you kind of look around, as you pan around this room, you'll see we have a birthing suite, we have a neonatal unit, we have a trauma unit, cardiovascular unit, so that we have different types of patients in every room. Built primarily for our community, built for our associate degree nurses, our baccalaureate degree nurses, and now we're partnering with University of Florida to bring their master's degree nurses here. They already bring their DNP, their doctorate in nursing, here. So with our many partnerships that we have with the community, and you just heard, I believe, from a couple of our partners from 2 ends of our counties, one at the very northern end of Manatee County up in Sun City Center, and the other at the very south end of our county at Inglewood Community Hospital, and how the collaboration works and the partnership work for our students today, and they can practice in this environment. This environment was really sort of the brainchild, I suppose, of myself and a few other nurses around, and particularly some nurses in the community. How can we create a safe environment for students to practice in that really simulates the real environment? And I have had many, many hospital personnel come through this center and say to me, "Oh my gosh, this is just like our ICU," or, "Oh my goodness, this is better than our ICU," okay? And that is exactly true, because now our students can come here, they can practice in a real life environment, and they get so attached to these patients. I don't even call them mannequins anymore, they're really patients. If you listen to the students as they move through a scenario, they may first look at that mannequin that we have here behind me as a mannequin. But before they are done, that mannequin takes on the persona of a real person. And that's what we're really wanting for our students to see. In the end, we will have much, much safer practitioners at every level for our community. And that's what this entire center is all about, making safe practitioners, confident practitioners for our county.
You know, one of the things that I heard both of the community partners tell me earlier was the importance of being able to recognize that really nursing education is lifelong learning. How is this going to support that concept of lifelong learning?
Lifelong learning in the life of a nurse is just that. You never stop. every day there is something new. Every day there is some new evidence that's presented that says this is the way we do it now. I went into nursing a number of years ago, and dare say that some of the skills and some of the things that I learned then we would not think of to do today. So that's where this center is really going to come into play, where we can bring our practitioners that are in the institutions, whether they're RNs at any level, and bring them in here and say, okay, what is the new thing that's going on? What is the evidence that supports what it is you're doing? Show us. And this center is going to help with that.
And of course, the other thing it does, I would think, even though we have clinical experiences that our students have, based on their time in a hospital or a facility, they may not always see some of the scenarios that they actually will see daily in their work life. So I would think that this really gives a student a much more holistic educational experience, because what they don't see at a hospital, they can see here. Is that right?
Boy, that's absolutely right. You know, we have our associate degree students here for 2 years. We have our baccalaureate students here for another 2 years. And if they wanted to see a live birth, you know, that happens when it happens. And if you're not there at that exact moment, you are not going to see that. And with our birthing suite here, we have the ability to actually simulate a real live birth. And we can catch that baby, and they get the full feeling and knowledge of what is going on. If we have a mama that's hypertensive, you know, we can simulate that here. And what is that baby going to look like when that baby comes out? And what are we going to do immediately when that baby gets here? So those are some of the things that we can work on here. Collaboration with our physicians and our medical team is a big thing. Learning how to collaborate and work in teams. Learning how to understand each other's practice and work at the full scope of our practice. And that's part of what we're going to be doing here in this center as well. So we're very proud of this center and invite the community in at any time.
Well, and you can certainly see how passionate Dr. Hesselberg is about this. So we hope that those of you out in the community, if you haven't had a chance to see our Medical Technology and Simulation Center, that you'll come by SCF Lakewood Ranch and do so. Dr. Hesselberg, thank you so much for letting us tour your facility today.
And thank you so much for being here. I really appreciate it. Thank you.
And we'll be right back. We're standing outside of the Manatee Memorial Hospital Foundation Nursing Wing with one of our faculty, Dr. Beverly Hindenlang. Beverly, tell us a little bit about your background, because you haven't been with us all that long here at SCF.
No, I have been here about 1.5 years, but I come with 22 years of nursing education experience. And I grew up in Michigan, so my bachelor's and master's are from the state of Michigan, and my doctorate is from Case Western in Cleveland. And I have taught in 4 different nursing programs, this being the culmination of all of my experience.
How has this nursing program been unique in your educational background and experience?
It has been unique because it is a new program to begin with, and it is a program that has been heavily supported by the community. And there is a very good relationship between the community and the program here at the school. We are addressing a definite need in the community because we have a lot of nurses who are associate degree prepared, but there weren't opportunities in the community for them to continue their education to that BSN degree.
What makes this BSN degree different from other degrees that perhaps might be in the region?
The students in our program are able to complete all of their education right here in the community. We started out with a cohort in Bradenton and a cohort in Venice. Those 2 cohorts will be graduating in May. And then we have added a cohort each semester, so we now have 2 here at Lakewood Ranch and another one that just started last week in Bradenton. And again, the advantage is that they will be able to complete everything, their clinical, all of their classes, right here in their own communities.
So what would you tell someone who currently has an associate's degree and may be a little reluctant about coming back to school for their BSN? Because it sounds like really in this day and age, I mean, you've got to have that degree in terms of your own professional growth and experience. What advice do you give to that reluctant student?
Well, I can tell you last night in class we were talking about the art and science of nursing. And one of the students, again, a new student coming back, said, yeah, I see that we learned about the science of nursing in our associate degree program, and now we're focusing more on that art and the professionalism of nursing. And I would tell those students, just come. We have students from with a lot of different experiences. We have students that come right from their associate's degree that don't have a lot of clinical experience, but know how to study and know what to do while they're in school. And we have other students that have been out of school a long time but have tremendous clinical experiences to share. So each of them comes with their own strengths and their own challenges, and we as faculty work with them in helping them to succeed. They also, because we have a small cohort, they get a lot of support from each other. And I would invite them to come and see what we have here, and I know that they will be pleasantly surprised.
Okay. Well, thank you so much for taking your time and dedicating your professional career to bringing others into the profession. It sounds like we're very lucky to have you on our team.
Thank you very much.
I'm standing outside of the nursing wing with one of our other faculty, Carrie Hockett. Carrie, tell us what you do here at SCF.
I teach in the RN to BSN program. I teach health policy and economics. I teach research and evidence-based practice, leadership, and a capstone course, which kind of tops off the end of the program.
Now, you come to us in a very unique setting in that you started out being one of our community partners, helping us dream a little bit about what this building was going to be about. And now you've joined us on the other side of the fence. So tell us a little bit about the perspective on either side.
You're right, Daisy. I spent 30 years in acute care at Sarasota Memorial, where I functioned as an advanced practice nurse in adult hematology and oncology, and then as a director of several departments there, including the education, research, and clinical practice department. And we had a real passion to increase the level of education among our nurses and promote getting advanced degrees. And having this baccalaureate program in the community has been such a godsend that the nurses don't have to travel and have this state-of-the-art facility to learn how to transform their practice at the point of care and ramp up their clinical practice. As a community partner, I had input into the curriculum, and so it is such a privilege for me to be here now teaching it. And it's a great thrill to have this facility here, state-of-the-art.
Tell us a little bit about what you see in terms of the students that we have coming into the program. How would you describe them?
These are nurses who have been working, and so they see the immediate benefit. They don't have to learn how to be a nurse. They know how to be a nurse. What they want to do is advance their practice and take it further and increase their clinical skills as well as their leadership and their professional development. So they get pearls every night that they're in class. They walk away with something new, and they come back the next week and tell you how they've implemented that either in their professional presentation on the unit, their leadership skills, or they tell you how much better of a clinician they are. Dr. Hindenlang and I had a student come up to us after the first semester and say, I am a much better nurse than I was 4 months ago. And it was just so great to know that we're making such an impact at the bedside with what we teach in the classroom, and it's just phenomenal.
And for some of us who may someday be patients, we'd like to know that our nurses have had the best possible training and experience. So thank you so much for being one of those people, ensuring that we do continue to have quality nursing in Sarasota and Manatee counties.
Thank you, Daisy.
That that wraps up this edition of SCF on Campus, where we've spent the day at Lakewood Ranch learning how the State College of Florida works with our local workforce to ensure that we have quality trained individuals. Many thanks to our SCF team, Dr. Bonnie Hesselberg, and our faculty in our RN to BSN program, as well as our CCD staff, David Auxier, but most important to our community partners from Suncoast Workforce and local hospitals who have worked with us to ensure that a quality workforce is available here in our service area. So on behalf of the State College of Florida, we hope that we see you next time at SCF on Campus.